I'm Anamarie. Welcome to Snack Chats with TLB.
Hey y'all, I'm Dani.
And today we're going to talk about PCOS, as Danny and I both work with a lot of clients with PCOS. So I'm just going to jump in. What is PCOS? I feel like this is such a good question. Um, and PCOS is a metabolic and reproductive disorder that affects 1 in 10 people. Um, and I think something that a lot of people don't know about PCOS is that it's highly variable. Everyone kind of has different characteristics and symptoms, but there are some like key uh, diagnoses that are usually based on a combination of factors. So um, they tend to be irregular, absent menstrual cycles, clinical or laboratory signs of androgen excess. Um, and that kind of means like typically high testosterone levels. We see a lot of clients that will have like excess facial hair growth or hair growth on their chest or different things like that. Those are some common symptoms. And then the next one is cysts or follicles on your ovaries from an ovarian ultrasound. Um, and yeah, just to clarify, like not everyone with PCOS has cysts or these follicles. I say cysts and follicles interchangeably. Danny, do you do the same thing?
Yeah, same.
Yeah. I've heard it's like the correct term is follicles, but it's called
But it's
polycystic.
called cyst, which I
Mhm.
think just goes into why PCOS is kind of poorly named, but that's another
Yeah.
topic.
Yeah, another topic for another day. But if you hear me say cysts or follicles interchangeably, they're technically the same thing. So,
Yes.
but yeah, not everyone has these cysts on their ovaries, which is kind of confusing since, yeah, it's in the name. But that's why it's important to highlight all these other key features of PCOS. Um, and Danny, I think you have some information on like the metabolic components of PCOS. I feel
Yeah.
like I missed anything from like the what is PCOS
No, I think that
work
that's
note.
yeah, I think you did a great job of just kind of an overview of kind of some of the diagnostic criteria. And I think that you had a great point that it's like PCOS is more than just a reproductive disorder. And so it has a really strong metabolic component as well. Um, Kind of going into why I think like PCOS is kind of poorly named is that it's really not just cysts on ovaries. As you mentioned, not everybody has these cysts on their ovaries.
Mhm.
And as more research is coming out, we're finding out that, PCOS is really a metabolic endocrine reproductive disorder. And so with that, a lot of individuals experience insulin resistance, which can really increase the risk of blood sugar imbalances and then increase risk for prediabetes and type 2 diabetes. And with that too, PCOS is linked to an increased risk of high cholesterol, high blood pressure, and other cardiovascular concerns. So, as you can tell, there's lots of different aspects as to kind of how PCOS works and how it influences all these different areas of our health. It's not just that people might have trouble getting pregnant or having, irregular periods.
Mhm.
So I think that's really important to note. I also wanted to go into a little bit of some myths because I think PCOS can be really misunderstood. So, as I mentioned, it's not just about fertility, there's so many other aspects to it. And one of those too is just the varying symptoms. Everybody with PCOS has, some different symptoms. It shows up differently in everyone's body. And one of those symptoms can be weight gain. And so I think a lot of times when weight is talked about with PCOS, it's talked about as it's this treatment. You just lose weight and everything's going to be fixed. But that's really not the case. We look at it more as this symptom and, really restricting, forcing weight loss can actually make some of these things like insulin resistance worse. And so we'll go into some of these nutrition therapy um, kind of quick tips for living with PCOS, but I really like to highlight that what we try to do, especially at TLB, is focus on symptom management, supporting energy, blood sugar, and hormone regulation, as opposed to just focusing on weight. So I'll pass it back over to Anamarie if you want to lead us into just kind of some quick tips for living with PCOS.
Yeah, yeah, I think that was such a good point you made about like the myths I hear all the time. Like, well-meaning providers will like recommend like complete weight loss, and it's like, oh wait, but that's the thing that's going to be challenging because that's a symptom of like undermanaged PCOS, right? So,
Right.
I think it's so important because I think a lot of clients feel a lot of discouragement around that, like they're doing something wrong. And so I think it's really helpful to like debunk those myths. But yeah, along with that, I feel like another myth that I hear all the time is like, I have PCOS, so I heard that I should like stop eating carbohydrates or like I shouldn't eat anything with carbs. I need to stay away from like these foods. These foods are bad, right? Um, but the main thing that I focus on with nutrition support and folks with PCOS is that it's really about making sure that you're nourished regularly to support like stable energy and your hormones. So what that looks like is eating consistently, eating every 3 to 4 hours, 3 meals a day and some snacks sprinkled in, and then making sure that there's variety. So pairing your carbohydrates with protein and fiber to help with like that digestion and metabolic processes, and like that insulin component that Dani was talking about a second ago. So you don't have to like cut out all the foods you love, or like cut out an entire food group. Like your body needs those things. So I think it's really important to debunk that myth and explore like how to nourish yourself sustainably there. Um, and that's the nourishment component. Dani, anything on the nourishment side that you
Yeah.
have ideas
No,
on, or do you
I
want to
think you
jump into the
covered it
movement?
great. Yeah, I just want to highlight too, it's like we don't have to cut out carbs. Hopefully, people that are listening to this kind of get that message because I think that's something that and the weight loss, I think I hear that all the time. And it's like,
Hmm.
wait, that's not quite what we want to recommend there. So we need that. We need
Yeah.
carbs. They're important.
Yeah, totally. And like there's a whole stress component with
Yeah.
PCOS, and like it's really stressful on the body to not be nourished and to
Yeah.
not have like that consistent carbohydrate energy coming in. And I was like, yeah, no wonder your body's freaking out. You've like cut out all carbohydrates.
Right.
So,
Yeah, carbs
yeah.
are a main source of energy in
Yeah.
general, but also for movement, which kind of leads me into my next point that movement can be a really important part of managing PCOS. Obviously, we don't want to force any movement. Like, I think, as you mentioned, kind of that stress component is big. So, making sure there's movement that feels good, that people find really fun and enjoyable to do. That's important. And so having consistent activity can help with insulin sensitivity and improving mood and also fatigue. And it doesn't have to look like a specific movement. I don't think there's necessarily one type of movement that it's like this is the only movement that you should be doing with PCOS. Really, I think the most important thing is like if, whatever you enjoy. So strength
Mhm.
training, walking, yoga, dancing, whatever that is or whatever that looks like, I think can kind of can work for each individual person. I will say with movement, strength training can be a great part of a movement routine because in building muscle can help with insulin sensitivity. However, if somebody really dislikes strength training, I think that's something to talk about with your providers and talking about a way to have a healthy relationship with movement um, that you enjoy.
Yeah. Yeah, I talk about, I'm sure you do today, like joyful movement. It's like finding that movement that really feels good in your body. And sometimes you're like lifting things up and picking things up more than you realize. So
Yeah,
it doesn't always look like let's hit the gym and pump some iron, right?
Right,
So
totally.
yeah. But yeah, I think like continuing on this like stress exploration, managing stress is like through movement as well. And then like sleep and stress is a whole other component. And I think it's important to highlight all these things because people will zoom really far into the nourishment and like it's all about the food and almost get like really rigid. And so sometimes I like to zoom out and it's like nourishment is a component, sleep is a component, and like movement. So, I know it can be stressful to think about how to manage your stress, but the easiest, most like basic need of our bodies is sleep. And so I think starting there with like a basic body need. And if there's like sleep issues, maybe working through that with your providers, figuring out like ways to manage that, aiming for 7 to 9 hours of sleep because poor sleep can worsen hormonal symptoms, which is really unfortunate. Um, and if sleep is really something that someone struggles with, there's so many other ways to manage stress, like breath work, therapy, journaling, mindfulness, nourishing yourself consistently reduces that stress. Um, Different things like that as well. So it doesn't have to look like one way. I know TLB has like a breathwork video. I think Marcy leads it. So you can always check that out too, in addition to this video. Um, yeah, that's one way to also support that. And supplements is another huge topic,
Yeah.
Dani, that I think you're going to take away.
Yes, I can lead right into that. Supplements I feel like it's huge with really any chronic disease, but I know my clients are constantly asking me about like, I saw this supplement, is this going to help with these symptoms? And the lame answer that my clients don't really like is like, it kind of depends. It depends
Hmm.
on what your symptoms are, but I'll kind of go into some of the main supplements. So the main ones that I kind of focus on are omega-3 fatty acids. So like fish oil, vitamin D, and inositol. And so omega-3 fatty acids, you can get that from a fish oil supplement. You can also get it from nuts or foods like salmon, flaxseed. Those kind of have it naturally. And this can reduce inflammation and also support metabolic health by regulating lipid panels. So that can be really helpful. Sometimes people do just need that supplementation, even if you do get a lot of your food, or a lot of omega-3 fatty acids from food. Another thing too is vitamin D. This is something that's just really commonly low in PCOS. So same thing, you can get it from food, you can be outside all you want, and sometimes you just need to supplement, and there's nothing wrong with that. So this is something to, check those labs and see where your vitamin D is at and talk with your dietitian about supplementation. Um, Another one, like I mentioned, is inositol. And so this is kind of what is like coined as like the PCOS supplement.
The famous supplement, I
It's
feel like.
famous.
Famous,
Everybody
famous. Yes.
everyone talks about it. It's probably the biggest supplement there
Yeah.
for PCOS. And for good reason. I mean, this is like one of the most researched supplements with PCOS. Um, Research shows that it can support cycle regulation and also improve insulin sensitivity. A lot of people will try inositol first before even looking into medical or medication options, but always important to talk with your providers about this, and making sure that you're getting a supplement that is trusted. But
Mhm.
that can be a really big one. I hear about lots of other supplements too. Like we've got like B vitamins and iron, magnesium, all those things. I think with those things, that's really where it's important to talk with your dietitian about what are your specific symptoms you're trying to manage and is it appropriate? You could spend hundreds of dollars a month on supplements, but I don't know if you really want to?
Yeah.
So, um,
Yeah. Sorry to cut you off, but I'm
oh yeah.
curious, like, I think it's important to highlight, like not all inositols are created equal.
Yeah,
I
definitely.
think you mentioned like the reputability of the inositol supplement, but there's a lot of research around the ratio, which again could be a
Yes.
whole other video, but just noted like speak to your provider about it, but it's typically this 40-to-1 ratio for inositol. And I have clients that are like, yeah, I'm taking it. And then I take a look at it and it's like, oh, this is like not the best like combination for what you're needing. So I always like to highlight that. And
Yes.
yeah, Dani, I don't know if that's something that you like also talk about, but yeah.
Totally. I'm so glad you mentioned that. Yeah, the type of inositol is important. So a 40-to-1 myo to decyro ratio is really important. So thank you for highlighting that. That can be something that, yeah, you talk with your dietitian. We can kind of
Hmm.
check over to make sure it's like an appropriate one to be taking. But yeah, there's so many different supplements. I want to mention too that there are medication options for PCOS. This can vary as well. So some of these options are like metformin, hormonal birth control, spironolactone. Those are kind of the big ones. Obviously, we're dietitians. We're not prescribing that, but we can help you advocate for yourself with doctors, you know, talking about just these different symptoms that, might be difficult to live with and that you might want some help for. So I think that's a really big thing as well. And, just kind of want to like wrap it up here as well. Just want to talk about too. We know how difficult that this condition is to live with. I personally have PCOS, so I get it. These symptoms can be super frustrating. It can feel like you're doing everything right, and symptoms might still pop up for whatever reason. And so we really just want to highlight and validate that. We know what you're going through. Um, and it's really important to have providers that you trust, specifically weight neutral providers. And these providers can help you ask for labs beyond just weight. So glucose, insulin, cholesterol, hormone panels, lipid panels, all of that stuff. Hopefully finding some weight neutral providers that you trust can help in managing this really tricky disease.
Yeah, I feel like there's so much stigma associated with PCOS, and there's so much like I do in session with deconstructing some of that like stigma that people have received on what it looks like to manage and care for your PCOS. And the reality is like people in all types of bodies have PCOS, right? And so it's about looking at that symptom management and advocating for your medical care needs. And yeah, I think everyone with PCOS should be seeing a dietitian if it's accessible, right?
Yeah.
Because there's just like so much knowledge there that we can help you gain. And that way you can make informed decision making in your medical care provider's office and with your like food routine, movement routine, and just like how you want to feel and live in your body, right? So,
Yeah.
um, yeah, but I think that's it, right?
Yep. That's what we got for
That's
y'all today.
that's the PCOS 101. Yeah. But yeah, I think, is there anything else we need to say? I guess comment, like, subscribe.
Yeah.
New to this YouTube thing. The Snack
Yes.
Chats was fun. There's so many other videos on our YouTube channel with so many other chronic conditions and questions
Mhm.
that you may have about your health. So go ahead and like reference those or head to the TLB website and you can inquire. There's an inquiry form and you can get more
Mhm.
information about establishing care, or we can support you in finding a provider and network and or within your area. So
Yeah,
yeah.
absolutely.
Sweet.
Thanks everyone for
Okay.
listening. We'll see you on the next one.
Yeah. Bye.
Bye.